Unmute.
Okay.
So in general pathology, last time we have seen a cell which is undergoing stress. First, try to adapt itself. These are known as adaptations. These adaptations with the cell, these adaptations, as we have stated, they may be in number, with the size of cell, with shape, or with orientation. These were the adaptations. Number may increase hyperplasia, number may decrease, that is atrophy. This was hyperplasia. Size may increase hypertrophy, hypertrophy, and size may decrease, that is atrophy. Shape. Change in shape was metaplasia. Metaplasia. Change in shape was like this. These were some columnar cells in mastitis. They change to, their shape changes to squamous. Squamous. That was the change in shape. Orientation. This was the dysplasia. Then, after this stress is removed, if this stress is removed, the cell will come back to normal. So a cell which is undergoing stress may adapt in by changing the number, size, shape, orientation. If we remove this stress, then it may restore itself. That is normal cell. What happens if the cell is unable to this is your normal cell. We have applied stress, cell adapted itself, adaptation. If the cell is unable to adapt, unable to adapt, then what will happen? Cell injury. Cell injury. Another cause may be direct injurious stimulus. Direct injurious stimulus that may cause cell injury. This direct stimulus may be hypoxia, free radicals. This cell injury this is reversible cell injury. Then this reversible cell injury will reaches at point of no return. What is point of no return? Point of no return means profound cell membrane damage and profound, that is maximum, mitochondria damage. When these 2 points are there, then definitely it will enter into irreversible cell injury. What will happen after irreversible cell injury? Cell death. Cell will die. So till here We have covered what is stress, mild stress, cell will undergo adaptation. That was maybe size, shape, number, orientation. If the cell is unable to adapt, then will happen cell injury. This cell injury, in old terminology, it was called degeneration. So cell injury or degeneration, there are two ways. One is either a cell unable to adapt, or there is direct injurious stimulus like free radical or hypoxia. So in this lecture, we'll study what is reversible cell injury, its two causes. One is hypoxia, one is free radical. Then after this injury, we will be getting two patterns, cell swelling and fatty change. Fatty change. After cell death, after cell death, what will happen? Morphological changes will be there. Some morphological changes, and these are also two. One is necrosis, one is apoptosis. So in reversible cell injury, there are two patterns, cell swelling and fatty change. In irreversible cell injury, there are two patterns, necrosis, apoptosis. So first we'll see reversible cell injury. Cell injury that may be reversible or irreversible. In both the cases, in both the cases, you can say or early change, first or early manifestation. In both the cases is cell swelling. It was asked in ICAR 2019. First change, early change in reversible or irreversible. That is cell swelling. If we remove the cause, then it will come back to normal cell. It will come back to normal cell. It will restore. Otherwise, it will go into cell death. Cell will burst because of excess swelling. Cell death. That may be of two types, necrosis and apoptosis. So, in both the cases, in both reversible cell injury or irreversible cell injury, first change, early change is cell swelling. But but there is exception to this rule. Exception is apoptosis. Apoptosis. Apoptosis is kind of irreversible cell injury. It is a kind of cell death. But in this apoptosis, there is no cell swelling. There is cell shrinkage. There is cell shrinkage. So if I tell one sentence like acute cell swelling is the earliest change in all form of cell injury except except apoptosis. Apoptosis. This is a true statement. It is true. Acute cell swelling it is the earliest change in all form of cell injury except apoptosis. What happened here? Here happened cell shrinkage. Cell shrinkage. And in all other form, it is the cell swelling. So this MCQ was asked in 2019. The earliest change in all form of cell injury. Answer was cell swelling. But next exam, it can be asked that acute cell swelling earliest change except the answer will be apoptosis because this is the only case exception where cell shrinkage occurs. Here about cell injury, most cause hypoxia and is a four most common cause of hypoxia was ischemia, ischemia, and ischemia are many like thrombus, for embolus, so constriction that is hypoxia. Now, so if we start our topic with reverse injury, reversible cell injury, we'll see two causes with two causes. We'll see one hypoxia that is the most common cause with free radical. After this, we will go two pattern, two morphology, two pattern. One will be cell swelling, and another will be uh, cell swelling, and one is fatty change. Fatty change. So with reversible cell injury, hypoxia, then free radical. In reversible cell injury, what are the patterns? What are the morphologies? Same. We'll see cell swelling that is also known as degeneration. Hydropic degeneration. Hydropic means water influx and due to which cell is swelling. So we'll start with the hypoxia and we'll see what happens in reversible injury. Then go for free radical injury. So we'll start with the hypoxia. Hypo means low, oxia means oxygen. Low oxygen is available at the cell. So we'll see normal oxygen where it is utilized. Then we'll see what when there is low oxygen. Normal oxygen is utilized by mitochondria. This is the mitochondria. What is there? There is oxidative phosphorylation. What is the role of oxidative phosphorylation? ATP formation. Who is utilizing this ATP? Cell. In our cell there are potassium ATPase. There are calcium ATPase and many more. These are utilizing this ATP. Oxygen to the cell. This is the cell and this is mitochondria. If low oxygen is getting mitochondria, then there will be less oxidative phosphorylation. That may lead to less ATP, and ATP will disturb sodium ATPase function. That will be disturb these cells. So this is normal oxygen hypoxia. If we see what is the role of this sodium potassium ATPases and all, then we come to know this is cell. Outside is sodium. That is sodium which is in excess. The cell will keep on throwing sodium out. It does not want excess sodium. Sodium try to enter but it will throw it. But cell loves potassium. So it will take two potassium inside and throw the sodium out. And all these are utilizing ATP. If this ATP is not there, then this ATPase will not work. Then sodium will enter. Then calcium will enter. Then potassium will come out. Potassium will come out. Ionic imbalance is there. So how the reversible cell injury is going? We started with hypoxia, low oxygen, most common cause of cell injury. This hypoxia will come to mitochondria. Low oxygen. Low oxygen will lead to low phosphorylation. That may lead to less ATP. Game changer here. Yes. Who is utilizing this sodium, potassium, ATP? So this activity will be because of this. There will be failure of this pump. If it fails, then what will happen? Number one, water influx will occur. Is where is the calcium highest? Outside the cell. So calcium will right calcium influx. Then where is potassium excess? Inside. So potassium will efflux. So these are the changes occurring because of the less activity of this pump. Because of less activity. Second, we have rough endoplasmic reticulum. Rough endoplasmic. Because of this less ATP, there will be detachment of ribosome. If ribosome are, means it will decrease protein synthesis. If protein synthesis decrease, suppose it is a protein which is carrying lipid outside, lipoprotein, increase, that may lead to, if lipid is not going out, that may lead to lipid deposition. Lipid deposition. And lipid deposition is fatty change. Fatty change. So in reversible cell injury, these ions cell swelling. Swelling. This RER detachment of ribosome led to less protein synthesis, which throw the lipid out is not synthesized. So lipid will remain inside. Lipid will be there inside the cell. So lipid deposition will be there, which is called change. So these two, cell swelling, fatty change. These two are the two patterns of cell injury. What will happen because of this less ATP? Glycolysis will occur. Glycolysis will happen. Glycolysis will produce acid will decrease the pH. Acid will the pH, and less pH will cause clumping the chromatin. Clumping of the chromatin. This pH will also help in the detachment of ribosome. So less protein synthesis. Protein which is uh, helping not synthesized. So lipid will get deposit change. So I was telling reversible cell injury, also known as in old terminology, it was called degeneration. This we are studying because of hypoxia. Hypoxia. And it is giving two patterns. It is giving cell swelling. One, it is giving fatty change. Fatty change. Why cell swelling is there? This pump is not working. So what comes inside? Sodium. Who? Sodium? Water. So lot of water will enter. Water will cell become swollen. This is cell. This is known as cell swelling. There is some terminology given in books with cell swelling. Cell swelling. There are some terms. Number hydropic degeneration. This hydrophic regeneration, this term is in case of hepatocytes and renal tubular epithelial cells. Renal tubular epithelial cells. This term is used. Number two, there is one term, ballooning degeneration. Ballooning degeneration. This term is used for epidermis. In all the term, there is and there is swelling, but these are terms. Hydrophic degeneration for hepatocyte, renal tubular cell. Ballooning degeneration term used for epidermis. The example in FMD, vesicle, that happens in epidermis. We call it ballooning degeneration in FMD vesicle. There is one more term for this cellular swelling, that is cytotoxic edema. Cytotoxic edema used for CNS. And mainly which cell of the central nervous system? Astrocyte. For astrocyte, we use cytotoxic edema. So cellular swelling of hepatocyte is called degeneration. Cellular swelling of epidermis is ballooning degeneration. Cellular swelling of astrocyte, cytotoxic edema. These are terms used. In all the cases, there is entry of water and cell is swelling. So whether it is hypoxia, whether it be radical, because of these two, if we are studying the cell injury or degeneration, it will be up to a point, no point of, we have to study reversible cell injury. What is these two? No point of no return. Mitochondria and cell membrane damage. But excess, profound. After this, you will enter irreversible. So we have to study up to this. Hypoxia cause reversible cell injury or degeneration, and it causes two patterns, cell swelling and fatty change. And fatty change. So till now, I have explained cell swelling. Now we are moving towards the fatty change. Again, I will take the same example, that is cause of cell injury, hypoxia. Again, I will take example hypoxia, that is long that is producing less ATP. This less ATP causing less sodium ATPase function. And because of this, what happened? Inside my cell, water enters, sodium enters, calcium enters. Who is going out? Calcium. magnesium, they are going out. But what happens because of these things? Because of these things, cell swelling will be there. So this I have explained, cell swelling. What happens in these organelles will discuss at ultrastructural changes. Here, cell swelling. Next change, now we have to study fatty change. Fatty change. Why it is there? Why there is accumulation of the lipid? I will tell you fatty change. One mechanism is hypoxia. This is hypoxia. But there are other examples. There are toxins like CCl4, form like paracetamol. This may be also cause fatty change, but this is the most common cause. This is the most cause. Other thing which may change may be decrease of lipotropic factor. Who is lipotropic factor? Choline. In choline, you will find fatty change. Where this fatty change? Okay, then toxin. Lipotropic factor are less, like choline is less choline. So fatty change. But this is most common cause. What happens in hypoxia? Yes, less ATP. What happens because of less ATP? The rough endoplasmic reticulum will lose ribosome. Oh, so that will decrease my protein synthesis. Which protein? Lipid sporting protein. What will happen? Fatty change. Suppose this is the which is binding with triglyceride and throwing it out. If this protein synthesized, this will triglyceride will accumulate inside. That is called fatty change. So this is the reason. One reason. There are number of reasons like CCl4, chloroform, halothane, PCL, lipotropic factor, choline deficiency, fatty change. But in reversible cell injury, we are talking about that is the most common cause, which causes less ATP. Ribose RER will lose their ribosome. If they lose, no protein synthesis, no lipid, then where it will go? It will be inside only. This is called fatty change. This is called change. This fatty change, this fat which is due to we are studying, not due to your choline deficiency, CCl4, no. We are studying about hypoxia, fatty change. This fatty change mainly occur in those organs which are related with the lipid metabolism. It means liver mainly. Also, it is found in heart. It is also found in heart. So in case the fatty chains of liver may give color this liver, but this differ in species. In case of cat, it is white. In case of human, it is yellow. And in cattle, it is yellow. In case of horse, it is orange color. So this is the fatty change because of hypoxia, and in case of liver, the different colors. But in case of heart, the fatty change which occurs here, it is of two patterns. It is of mainly two patterns. One is due to moderate hypoxia and one is due to severe hypoxia. In case of moderate hypoxia, the condition is called thresh breast or tiger. It is also called tiger effect. In case of severe hypoxia, there is uniform change. There is uniform fatigue change. So in case of heart, the fatty change in case of heart, it is showing two patterns. Is uniform. One pattern is uniform. Whole myocardium is showing the fatty change. In another pattern of heart, some band in form of these are these are yellow band of your myocardium. This area, this area which is not involved, this is not involved, dark red brown. So because of these band, it is giving tiger effect or also called breast heart. This happens only in case moderate hypoxia. Moderate hypoxia. Hypoxia that may lead to the uniform whole myocardium, yellow color, uniform affected myocardial cells. So these two phases of the heart because of moderate and the severe. And of yellow. In between, the part is and this gave the appearance of tiger heart appearance or heart. But severe, then it will give a simple uniform yellow color appearance. So these are two facts seen with the heart and one fatty change which is seen with liver. In other organs, this fatty change case of reversible in case of with hypoxia that is causing cell injury and one was cell that is swelling of the cell. Second was change and fatty change. One was the organ is the liver and second was the heart. In case of heart, there were two patterns. One pattern was and another pattern was having some tiger effect because of the non-uniform distribution. So, in case of hypoxia or liver injury, these are the two fundamental patterns which are seen. So, after the hypoxia, we'll see the second cause, free radical, and that may lead to changes in the cell. Second topic is free radicals. Radicals. The meaning of these free radicals, there is one more common name is oxidant. They are called oxidant. Free radicals, they have unpaired electron in the outer or outer orbit. If this is one atom and this is outer orbit, there is one unpaired electron. Such chemical species they are called free radicals or oxidants. Free radicals they are generated normally and the site of mitochondria. Their generation production increases when there is oxidative stress. So in oxidative free radical generation increases. Chemicals or oxidants they are having one electron in their. So what is the mechanism of action of, as we know, electron causes oxidation, hydrogen causes reduction. So these are having so their mechanism of action will be mainly oxidation. This is the mechanism of action, oxidation. So, if these oxidants are generated inside the body, oxidant, their example, and their protective mechanism. So, oxidant, one hydroxyl free radical. It is generated by one Fenton reaction. This is known as most potent free radical. Second is superoxide radical. Third is hydrogen. Number four, singlet oxygen. Number five, nitrogen derived free radical like ON, oxy. So these are the oxidant and the antioxidant which are present inside the body. They are vitamin A and E, or they may be some proteins like like ceruloplasmin, and third is enzyme like catalase, oxidase, SOD, superoxide dismutase. So these are the enzymes. Out of these, this glutathione peroxidase is an antioxidant. Most potent free radical is the hydroxyl free radical. This is most reactive potent. And most potent oxidant is the glutathione. So these are oxidant and their scavenging system and vitamins, proteins or enzymes. There are some amino acids like methionine, methio present to scavenge these free radical or oxidant. These are the free radicals. How how the free radical cause cell injury, cell injury, where they act. They may act as the cell membrane or in they may cytoplasm. They may act in nuclear membrane or at the end they may act at. So these are where free radical may cause injury. Cell membrane, nuclear membrane, these are membrane. So this cell injury, because of the free radical, it is divided into three parts. One is for the membrane, one protein, one for the tail. There is no injury at carbohydrate. So we study for lipid, protein, and nucleic acid. So the free radicals which are attacking at lipid, where in the cell membrane, organelle membrane, and other membrane. So what they cause? They cause lipid peroxidation. This is the name of the injury. This is the name of oxidation. These free radicals they will attack double bond, double bond with fatty acid. They will attack. Then after this reactions occur, this lipid peroxidation it occurs in three. One is initiation where it attacks the then propagation, then termination. Naturally, in our body, it is terminated by the mechanism which is naturally present antioxidant like ACE and others. So these three steps, it damages injury is called lipid peroxidation on the double bonds. It initiates, then propagates. This propagation is called autocatalytic. If this antioxidant mechanism is not, so after propagation or autocatalytic reaction, it may cause. So the mechanism which is preventing antioxidant termination mechanism. So catalytic reaction prevented by the antioxidant. So after initiation, propagation, then it will lead to cell death because of this autocatalytic reaction or propagation reaction. So during this lipid peroxidation, there is one important molecule which is peroxidation. There is lipid derived molecule and the hypophosphates. It is formed. This is the cell nucleus. This pigment is present around the nucleus. This location is around the perinucleus. This is a marker of lipid peroxidation. It is a mark. Lipohydrogen brown pigment. It is an indicator or marker oxidative stress. Marker of lipid peroxidation. Marker of oxidative stress. Lipo means it is derived from the lipid. It is brown pigment, local nuclear, and it is a marker of this lipid peroxidation. So these free radicals. Number two, after injuring to the cell membrane lipid, so the first target was the cell membrane of free radical, and second is the protein. Free radical attack. Here they attack the here they attack sulfhydryl group. Then they cause of proteins. First attack is the DNA. In DNA, free radical attack thymine nitrogen base, thymine, and cause DNA fragmentation. Fragmentation. So these are the effects of free radicals in the which is called free radical injury. So there are two causes, yeah, and second was the free radical. This lead to cell swelling and fatty change. Fatty change. But this radical they causes lipid peroxidation, they causes protein cross-linking, and third DNA damage. So hypoxia free radical. They are causing three types of cell injury. If we use antioxidant, then it is reversible. And if in this we remove the stimulant, so this is reversible cell injury. But this up to which point? That is, if there is maximum, there is maximum cell membrane damage. Up to this, after this, it may become irreversible. So fatty change because of hypoxia and these three. If we use antioxidant, it becomes reversible, and if we remove uh, causes, it will become reversible. Up to which point found or maximum mitochondrial damage or maximum damage. Reversible cell injury. We have seen molecular or biochemical mechanism. And what are the morphological features like cell swelling, fatty change, free radical changes? Now we'll see what happens at the level of organelle. Organelle can be seen with electron microscope only. Scope. So these changes, this cell, this is mitochondria, this is lysosome, this nucleus, and this is the ER. So what happens organelle level that is seen by electron microscope only. Changes at electron microscope they are called as ultra changes. They are called as ultra structural. So in case of simple cell injury, we'll see what are the ultra structural changes. Number one, if this is the cell. We start with the nucleus. Then we'll come to ER, then lysosome, then we come to mitochondria, and at the end, cell membrane, microvilli. Microvilli. We'll see in this sequence. What happens in reversible cell injury at the level of nucleus? Normally, the nucleus is polar, homogeneous, genius. In case of reversible cell injury, there is decrease of because no glycolysis, acid are there, low pH. Because pH, this chromatin material clumping. So this change is clumping of nuclear chromatin. This change in nucleus, it is called clumping of the chromatin, where this granular becomes clump in different patches, clump different patches of the losing its granularity and homogeneous nature. So this happens at nucleus level. Next we'll move to so we are studying ultra structural changes. So what happens at nucleus level? There is of nuclear material. Second, we say after this it is at ER. So number 2, of endoplasmic reticulum to detachment of ribosome. In case of rough ER, this is there are ribosomes. These ribosomes fall into cytoplasm. They may fall into cytoplasm. So that from this ER was early change, elation seen reticulum. First change is, but at the level of organ is the endoplasmic reticulum dilatation, which is early change or it is the first change, which is seen with electron microscope. It is the dilatation of the endoplasmic reticulum. So, mitochondria. There is mitochondria. In case of sodium and water, it is entering along so entering. So there is mild influx of calcium. So cytosolic calcium rises, but it is mild. This calcium will deposit on the mitochondria. It is called amorphous mitochondrial density. Amorphous mitochondrial densities, and these densities are small in size. In case of irreversible, densities will become large and multiple in number. So, first time uh, amorphous densities are seen in reversible cell injury, but they what happen at the zone? Autophagy. Number 3. Autophagy is seen at the level of lysosome. Lysosomes have not burst yet. In irreversible, not burst. In irreversible, they will be bursting out. Only auto. Last is cell membrane, organelle membrane. Membrane or organelle membrane. What happen at this level? There is activation of phospholipase because they are made up of due, due to mild increase of it may activate the phospholipase. These cell organelles or cell membrane they may fall inside the cell and they form like this structure called myelin figure. About myelin figures, number one, they are derived from cell derived from cell membrane. They are made up of calcium, mainly they are seen answer is electron microscope. They are seen in answer is reversible and irreversible both. So two electron microscopic changes, one with mitochondria and one with cell membrane. Mitochondria. Small, these are amorphous bodies. Amorphous bodies. And with the cell membrane, myelin figures. Both myelin figures appear in reversible cell injury, but they maximum in irreversible cell injury. Amorphous bodies, they are appear or small in reversible cell injury. They are maximum, they are large in size in irreversible cell injury. These are two important points where they appear after when they become maximum. So, two related myelin figures. Myelin figures mainly mainly seen in reversible cell injury and irreversible cell injury. So answer will be irreversible injury. Second, myelin figure appears first in is reversible cell injury. Similarly, amorphous bodies, mainly or chiefly, they are seen in reversible cell injury or irreversible injury. Irreversible cell injury. These were some ultrastructure or organelle level changes in. Then, after reversible cell injury, it comes to point of no return. Means there is found cell membrane is damaged and there is mitochondria damage. Then it will move towards the irreversible cell injury. So in case of irreversible cell injury, there is very high like, calcium, and this calcium activates many enzymes like nuclease, like nucleases. Because of activation of nucleases, nuclear changes are number one is nucleus become that is called pycnosis. Number two, fragmented karyorexis. Number three becomes powder that is karyo karyolysis. So these three nucleus of activation of the endonucleases enzyme because of high cytosolic. Then number two is protease. They may resist cytoskeleton of the cell. Cell becomes cell loses its architecture. Cell loses its architecture. The third type of enzyme activation after protease. So first was nucleases, which gives three type of nuclear changes. Second is protease, protease, and third is the phospholipase. Phospholipase will destroy cell membrane, and cell membrane will lead to formation of large number of myelin fibers. For mitochondrial changes in cell membrane of the mitochondria, deposition of large amorphous densities, and there may be last is there may be rupture of lysosome. So lysosome it release all its enzyme that may lead to the cell death. Cell death. So we started with adaptation, then reversible cell, irreversible cell injury, and after this irreversible cell injury, there is cell death. After this cell death, after after 12 hours of cell death, there are two morphological patterns seen. One is necrosis, other is apoptosis. What are the patterns which are seen in reversible? It was cell swelling, it was fatty change. Or what are the physical patterns after irreversible cell injury? Necrosis and apoptosis. So if we compare from nucleus, ER, mitochondria, lysosome, microvilli, and cell membrane. These two reversible cell injury and irreversible cell injury. Number one, nucleus. Here the nucleus changes clumping. In this case, there are three nuclear changes: pycnosis, karyorrhexis, and karyolysis. Number two, with mitochondria. With mitochondria. Number two, with ER. Of reversible cell injury, there is dilatation of, but here there is lysis or degradation or disruption of the ER. Number lysosome. Here we see autophagy. In this, there is rupture of the lysosome. Then, two things. One is mitochondria. There are small amorphous densities. Densities. In mitochondria, large amorphous densities. Then, uh, with cell membrane, myelin figure. Myelin figure, first time they appear. In here, there are multiple myelin figures. Multiple. So mainly myelin figure are in the and mainly amorphous density are in the irreversible. Here, first time they appear small or they may not be present. Irreversible is has crossed point of no return. Some differences at ultrastructural level. So if we see cell injury, studied at four levels. One is your biochemical or molecular change, ultrastructure change, microscopic change. Microscopic, we come to the gross. So the first change is the biochemical change, or also called molecular. Is the first change in case of cell injury. We started this story from the normal cell, then adaptation, which were in the shape. Then we came to reversible injury and two causes. One that is the hypo is nothing but most common cause, and second we said is reactive injury. If we reach to point of no return, means after this point it will not return. Stimulus you removed. These were 2 points. One was mitochondrial damage and profound cell membrane damage. This it will enter into irreversible cell. In reversible, we saw two patterns: cell swelling and fatigue change. Fatigue change. In irreversible injury, we will see two changes. One is are the cell death changes occurs to cell death, necrosis of toxins. Necrosis like coagulative, like liquefactive, and some special. Apoptosis is of following type: extrinsic pathway and intrinsic pathway.